This is Sarnia Lambton Daily for Tuesday, May 12th. Good evening, I'm Terry Doyle. The number of positive cases of COVID-19 in Sarnia Lambton and the number of people considered recovered from the virus has increased by the same number. The latest update has a total of 203 people have tested positive in the region since the pandemic began. That's up 3 from Monday's update. 145 people are considered recovered from the virus, also up by 3. There are 41 active cases currently in the region. The federal government announced today that seniors eligible for old age pension will receive a one-time extra payment of $300 to help dealing with COVID-19 related issues. Those seniors who are eligible for the guaranteed income supplement will receive an extra $200 on top of that. The money is expected to flow within weeks. The City of Sarnia and local officials held another virtual community forum and media conference today to provide updates on what is happening in the region. We're going to bring you portions of that throughout the rest of the show today. We'll start things off with Lambton County Warden Bill Weber.
Pleased to be here today. I'd like to start off with a shout out to the nurses. It's National Nursing Week, and we have a lot of public health nurses, a lot of nurses. And we just need to thank them for what they do for us in the community and acknowledge the week of celebration for those nurses. So everyone has been doing a fantastic job in Lambton County, the locals with social distancing, hand washing, and keeping that. And we've had great success, I believe, at flattening the curve. So going forward, I hope we continue to do that. There is some things opening up. We have a long weekend coming up, and I hope that through that we don't set things backwards by having too many visitors come. We want the economy to be move forward, but I don't think we're ready yet to have a lot of visitors here. I think people need to come and visit their cottage, bring what they want with them, is the message that I believe needs to be out there. We need to continue with the physical distancing. So congratulate everyone for doing that. We've got a good panel this morning, so I'm looking forward to the discussion. And everyone, please stay home as much as possible and stay safe.
There's a song that's a favorite of mine by the group RANADE, and it is called The End of the World as We Know It, and I Feel Fine. I would say the first part of that song is so accurate that our world has totally changed. It's going to be years until there's a vaccine that it comes back to some sort of normalcy. The I feel fine part doesn't apply to any of us because it's now been 60 days. Our primary control group has been meeting since we declared an emergency. Every day we meet, every day we talk, and we try to look at how to protect the community. On the business side of things, as this is supposed to be about economic development, Sarnia Council on April the 20th took some very strong steps to cut costs, over $1 million, $1.7 million. And that includes 160 positions, seasonal and students that aren't going to be hired, 20 vacant positions that'll be left unfilled. And yesterday, we again took some belt tightening measures, because this is what it's about, belt tightening, and not hoping for the federal or provincial governments to rescue us. And we are extending the payment of taxes now to the end of June. The issue of the border is a big one right now. And I've got a letter going to the Prime Minister today on behalf of the Primary Control Group, asking them to continue to press the Americans to keep the border closed at least for 30 days, and I would hope even longer till we can get back to normal. I have a second letter going to the Prime Minister and to Doug Ford, both letters will go to them, asking for some assistance in small business. Because as they go through these physical distancing changes within their operation, as they go through putting up plastic shields, and they've been dormant for 2 months with no income, they need some specific assistance. And I just want to say in closing, last week, it was the 106th anniversary of the city since we were formed on May 7th, 1914. And keep in mind, this is a difficult time, but we've been through world wars, 2 of them, through a Great Depression. We've had great economic expansion. We had the building of the tunnel and the second bridge in Point Edward. And so we've seen good times too. And we will emerge from this. We will emerge from this stronger. And I close with my favorite quote from Helen Keller. She says, "Alone we can do so little, and together we can do so much." And that's the collaborative business, labor, First Nations community that I've been witnessing in the last 60 days. So thank you.
I just want to give my thanks from as a local MPP representing Sarnia Lambton. What a great job the whole community's done, both whether it's healthcare, first responders, the county, and of course the local council of Point Edward and the city, the mayor, leadership of the two mayors, and Warden Bill Weaver. In this, our healthcare workers, of course, and maybe it's, I don't know whether anyone else mentioned, but this is Ontario Nursing Week, so a shout out to our nurses. And I think the police celebrate policing this week too, so a shout out to both of those, as well as all of our first responders. So I agree with, I heard the tail end of Mayor Bradley's remarks about the border opening too quick. I agree. I don't think we should rush into that because we know what's going on in Michigan. We know, we actually know New York and which is on the other side of us. And then of course we've got our neighbors in Quebec. I don't know, that won't be as simple to solve, you know, about as far as that border. But I certainly agree with the mayor there that I don't think we're ready at that point to open these borders. And I think what you'll see is slowly gradual opening of more retail and other local venues here locally, as well as across the province. I know the province is trying to work with the medical officer of health for Ontario, and also of course our local medical officers of health too, with advice here locally. So I think that's about it. Just congratulate everyone on the job they've done so far and encourage them to keep on. Of course, our office is open at any time virtually, and my website, bobbailey.mpp.com. If you have questions, or we try to post everything from whether it's local or from the province on there to try and be as much help as we can at this time.
I would echo what's been said before and add my thanks to the nurses for everything that they're doing. Happy Nursing Week, everyone. I would just say in terms of an update that, you know, you can look at the Lambton Public Health website for numbers and graphs and all of those things, but the real point of it is that I think the public health interventions that people have been taking over the last few weeks have been working. Certainly we've seen a flattening of the curve. Are we over the curve? It's hard to say, but certainly at this time on a daily basis, we get either zero or a handful of cases. And we hope that that will continue with a sort of slow easing towards opening things back up again. And I think that's what we're seeing. And so, you know, on our side, we'll just stay vigilant for cases of disease while we try to open things up a little bit by bit, recognizing that there's a bit of a lag. So anything you do now takes about 2 to 3 weeks to show in the data or the numbers. But other than that, you know, I think we're really fortunate as a community, as we've heard, that everybody's been banding together to do the right thing here, and it's been making a difference. So thank you, everyone.
The last 8 weeks, as you know, has been very tough on everyone in the city and the province and the country. The hospital is part of this community as well. The main directives for the physical distancing, social distancing, etc., is to actually reduce the virus spread within the community and take the pressure off us as healthcare providers. Otherwise, we would have been overwhelmed. And we've all seen what happened in areas in Italy and New York where they had a huge number of patients presenting at the same time. So kudos to everyone in Sarnia and Lambton to help us out by reducing the number of cases and flattening the curve. We had a rapid increase initially in late March and early April of COVID positive patients in the county and the hospital, but we've seen a decline since then. Thank you again for all the public health measures that everybody has abided by. Having said this, from a healthcare perspective, we have been very concerned about our patients who have been waiting patiently for the last 2 months to get their needs looked after, right, from a healthcare standpoint. So moving forward, as we have had a better control over the spread of the virus, I know it's not complete, we still have some virus spread out there. It's not as bad as months ago, but nevertheless, the theme moving forward will be now how do we establish services, whether it's pertaining to us in healthcare or beyond us, so in the province, businesses everywhere else. We have to be very cautious how we do it. At the same time, be cognizant of the fact that there's patients waiting for help. I'd be happy to answer any questions that anyone has about those issues. But again, we are celebrating Nurses Week at the hospital, so happy Nurses Week. We've just celebrated Doctors Day on May 1st, and we have a whole bunch of different celebrations that we celebrate as well. Lab, the techs, everybody else who has been helping us now. I want to give a special thank from the hospital to our first responders out there as well, police, fire, and EMS. They are actually really at the very front of the front line. And everybody else who's been helping us to keep our municipal services going, electricity, water, stocking our grocery stores and our food supply, and keeping our food supply chain intact. So thank you.
The unemployment rate is sitting at about 8.6%. We have just over 57,000 employed and 5,400 unemployed. We're expecting those numbers to change, of course, when we get our finalized April numbers as well. Our research into the local workforce, we surveyed workforce members to look at how COVID has impacted them, and approximately 37% are out of work. 17%, an additional 17% are working from home. The majority of these were described as self-employed individuals as well. So the primary reason was, of course, business was closed or sales have decreased. The respondents were aware of support services that were available for the workforce in the local community, which is great. The Canada Emergency Response Benefit was one that was noted, as well as income supports provided by the federal and provincial government. But 60% still worry about having enough money for bills, rent, mortgage payments, as well as putting food on the table. We see a way forward really as supporting the workforce, especially the displaced workers that perhaps need to return to the same employment or find new employment, building community supports that allow community organizations that provide employment services to work together, and planning scenarios for the workforce in terms of what might happen when things start to reopen so we can support workers in this context.
On behalf of the Economic Partnership, supporting existing businesses has always been among our two top priorities. And given the current events, given the current need, we've really expanded our focus to ensure that it's our current #1 priority. We've ramped up our outreach to local businesses to help businesses navigate the available resources. There really are so many resources out there that it can almost become overwhelming for a business that is trying to deal with the immediate situation as well as to plan for the future. So we've been focused on helping businesses access information. We've built a business resources toolkit that municipalities, businesses, and others can access online through sarnialambton.on.ca. As well, we've built a feature into that subscribers can get an email update with new information as soon as it is posted, to try to streamline the information access. We've also formed a business and economic task force, which includes the Workforce Development Board that just spoke. It includes both chambers of commerce, includes tourism, includes Sarnia Lambton Business Development Corporation, with the primary focus to strengthen the information resources available to employers and to provide a timely response to the complex business issues that employers are facing. We're now into week number 8. It's amazing. It's week number 8 of twice weekly meetings to collaborate, to work together, and to assist businesses. There's a lot I could highlight, but given the time limitations, did want to highlight a couple programs and projects that we are working on. Currently offering free e-commerce assessments to employers, to businesses. We need to get more small businesses online if social distancing is going to be more than short term. So we're working very closely to provide those free assessments to give businesses the information they need to consider moving online and consider different strategies to move in that direction. We've also moved up the launch of an ongoing program, the Starter Company Plus program, which provides provides $5,000 investments for businesses towards their long-term business plan. We moved that earlier this year, given that there may be opportunities that businesses need to pursue around e-commerce, delivery, other innovations. So we moved that program earlier, and we're currently accepting applications until the end of this month.
There's no sugarcoating it. It is serious. And the actions led by the management team and Chris Carter, I think, were the right things to do. In my time at City Hall, I've always tried to protect the public, tried to protect services. But I'm not concerned about what's going on right now in May. And I'm talking about the economic storm. I'm not talking about the health storm. It is what's going to happen in June and July and August in the fall when we start to see the defaults. And there are estimates in the tourism business of up to 20 or 30% restaurants that won't reopen, other companies that will not be able to function. And when that hits us, I think we're well positioned right now. We've made some substantial cuts. We are scoping down, we cancel capital projects. We're doing everything we can to have the money to get through without substantial raising of taxes. And I'm also of the view, it came up at council yesterday, that we shouldn't be trying to recoup right after this crisis, whenever it ends, the money that was lost. That's our contribution to the COVID war. What we need to do is help people individually get out of this in a good situation mentally and financially. But I do think when we get into July, August, September, that's when we'll start to see, we'll be beyond, I suspect the property tax relief will end at the end of June, because it's costing us a couple of $100,000 as a city for that particular program. But I do really fear what I hear from the business community. It's not about handing them brochures or that type of action. This is so severe. This is worse than the recession we had in the 1980s. And I know, and I don't personally believe, is we need to stick to the science of health to move us forward. But at the same time, we've got to deal with some of those economic issues. So we can talk in July and August. And I hope I'm wrong. I hope I am. But everything I hear from the business community and the industrial community is that there's a rough road ahead.
Stay tuned, more to come from the Community Forum next on Sarnia Lambton Daily. Welcome back to Sarnia Lambton Daily. Tonight we are bringing you a wrap-up of the Community Forum and Media Conference that took place earlier today. Let's pick it up with Lambton County Warden Bill Weber after being asked for advice for people considering visiting their cottages this coming long weekend.
The maintenance of your cottage, going up to check on things, we ask that you bring as much supplies as you can with you. The only thing that's open, I believe, all along the coast of Lambton County, certainly in Grand Bend, the beaches are closed. The restaurants are for takeout only. So, and as the parks open up, they're opening up with no washroom facilities, no water taps, and all that. So bring your supplies with you and self-isolate, basically isolate in your cottage while you're here. It's an awful thing for a mayor or a warden to say, we don't need you right now. We need everybody to keep safe and stay home the best you can. I know it's tempting when the long weekend is upon us, but we need people to be self-sufficient in their cottage. We need this to happen now so that we can open in July and August, and the businesses can open that are going to open. So the longer that we can do that, and the better we will have economically for the rest of summer. Right now, there's not much open.
There is truth to the idea that the more testing we do, the more disease we will be able to pick up. But when we think about the healthcare system, and the healthcare system has been talking a lot for the last several years about the right care delivered to the right patient at the right time in the right place. Testing is kind of like that too, right? It's the right test done at the right time for the right reason and the right patient. And so I guess the idea is that we're, now that we've sorted through this testing backlog and we have all of these tests, it's also still important to use them wisely. And the test is most useful when a person has symptoms to decide if they have disease or not. The test is less useful in terms of how you interpret it when you do the test on someone who doesn't have any symptoms. It's possible that you can get some people with disease presenting that way and you can have a positive test, but what's harder is that more of those tests are going to be negative, and it's very challenging to interpret the results of a negative test in a person who has no symptoms. So really, I guess the answer to your question is that testing is always more complex than it sounds. And although we do need to have more tests, we also need to make sure that we do them in the right way for the right reasons.
But if you look at what's going on with small business, as the province rolls out, they can do certain things and people can drive up and all that. That has tremendous ramifications in trying to support them. For example, at City Hall, we've discussed we need, especially in our downtown and some of the other commercial areas, look, how do we enforce parking? When people are pulling up to pick up goods, how do we help that business owner? How do we function and not function the way we used to? The issue that I've just written to the Prime Minister and to the Premier on is to give them some specific assistance, small business, the 1, 2, 4, 5 type operation that you see in a lot of communities. Every community has that type of operation, to give them some support to be able to do the things they need to do to open safely, because they haven't had a cash flow for 2 months and they're suffering big time. And then on the home occupation, if there's one thing I can point to at the federal and provincial level, is that the individual entrepreneur is often not fitting into some of the programs where others are, and rent relief for bigger businesses, but individuals personally are having more of a struggle trying to find the right place to fit. So I'm hoping that, and again, I got to be really fair here. No one thought we'd be coming up with all these programs 2 months ago. They're all being devised as we run, and that's difficult to do. So I'm hoping that Bob and others can take that message back. Is there something specific we can do to assist those entrepreneurs, those home occupation people that still need to make a living, but are being overlooked in the general scheme of things?
The staff is doing very well. They've actually been remarkable over the past 8 weeks. In terms of exact numbers, we're down to 11 Blue Water Health staff members who have tested positive. And it's a mixed bag of did they get it at the hospital or community, so it's a mixed bag. Having said this, everyone's doing well. We're actually very eager to reestablish our services and serve our patients. We have initiated a whole, but we're still in this big pandemic, but the ship is turning towards reestablishing services. So we have a variety of committees and task forces and people working on how we can do this safely, so we can increase the services at the same time keep the patients safe as they come through the hospital, to ensure basically the physical distancing and we don't have overcrowding. And then we also have, many of us are looking at setting priorities of how urgent someone needs to come in, patient A versus B, and how fast we can go up. So it's a very complicated affair, actually. It's proving to be a bit more complex than the slowing down, turning off the tap. And we have directives from the ministry, and I would say they're all correct and make sense in terms of moving regionally, so we don't overuse so personal protective equipment, supplies, and ensuring that we have capacity if we have a second wave, which might happen. Hopefully it won't be as bad as the first one. So as we increase our services, we need to have mechanisms to slow down or even cut down again if we see more increase of viral spread in the community. So, and that's why we have to maintain our collaboration with the city, community, public health, everybody else, the ministry and the city. So the work is being done, but we have, the staff is actually very eager to get going and seeing our patients again.
Stay tuned. You are watching Sarnia Lambton Daily on YourTV. Recapping our top story tonight, there are 41 active cases of COVID-19 in Sarnia Lambton. 11 of those are staff of Blue Water Health. The federal government says those people eligible for old age security will receive an extra $300 in the coming weeks. Those who are receiving the guaranteed income supplement will get an additional $200 on top of that, for a total top-up of $500. That money is expected to flow in the coming weeks. That's going to do it for our show tonight. I'm Terry DOYLE. Thank you so much for joining us. We will see you back here tomorrow.